All right, welcome, especially you moms here today. So this video is with Dr. Britta Gauthier, and we are going to be talking about perinatal pelvic floor health and recovery. And I'm super excited to have you on today, Britta. If you don't know, Dr. Britta, she is a pelvic health physical therapist right here in St. Paul, nice and close by. And she helps with pelvic pain, incontinence, pain with intercourse, bowel dysfunction, prolapse, endometriosis, general orthopedics, a lot of things that can actually relate to the health of the pelvic floor. And she really has a special interest in supporting moms while they're pregnant to make sure they're as strong as possible and can feel good as possible. And then after pregnancy to understand if they're ready to run again, as an example, to really help with that recovery and get them nice and strong. She has an extensive Pilates training, which is a really nice way to help connect the brain and the body and become aware of all those little subtle muscles.
Mhm.
And like our office, she values an interdisciplinary and really holistic approach to health.
Mhm.
Very excited to have you on today, Britta. Thanks for being here.
Yeah, thank you so much for having me.
Yeah, you bet. And one of the reasons I'm excited too is not only with your great background, but with personal experience with my wife, having had great success with your work, not only from an ankle injury that she wanted to recover from, but also from having our own son. And I know she likes to be active, she likes to feel strong in her body, and your work has really helped her get back on track. So thank you for that as well.
Yeah, such an honor to work with her.
Yeah,
And
great.
fun too.
So, what we'll talk about today, then, we're going to talk about actually what is the pelvic floor. And I know you have a model that you can help paint that picture
Mhm.
for us so people get a better understanding of that area down there that isn't always too clear on what it is. And some of the things that you recommend as far as stretches and strengthening to support the body during pregnancy. And as I mentioned, after pregnancy recovery. And then also, we'll talk about if someone's trying something at home, what is the point where they know they need to go see a specialist?
Mm, mhm.
So, let's jump in. I'm curious what got you into being passionate and excited for the pelvic floor specifically.
Yeah, it wasn't where I first thought I would be diving into as a PT. We actually only had one day of lectures on the pelvic floor in physical therapy school, which is pretty wild. Hopefully, that's changing. Um, I first became really passionate about the pelvis when I did my Pilates training, actually. And I ended up treating a lot of mostly women. They tend to gravitate toward that a little bit more. Men need it too. And I was doing a lot of treatment for low back pain, hip pain, and connecting with abdominals and glutes for strengthening. Um, and I just felt like something was missing. So I had this sort of aha moment where I'm like, oh, I'm missing the whole bottom piece of the core. At that time, too, I was going through a personal kind of pelvic health healing journey, kind of regulating my cycle and learning a lot more about that personally. And I had friends asking me about it, like, hey, I'm having pain with intercourse. Can you help with that? And it was like one of those times in life where the universe just kept sending signals to me of like, hey, you should think about trying this. And I talked to mentors, ended up finally taking a course on pelvic health. And I knew right away that it was what was right for me. It was kind of my calling. Um, my favorite part is empowering women. Again, and men too. I just tend to see more females and having them connect with that part of their body, learning about that part of their body, the different muscles, the joints, and kind of taking away the stigma around some of the sensitive topics around pelvic health, right? It's kind of embarrassing to talk about, peeing your pants. And so I like to create a safe space for that and just let them speak about that openly and without shame. And it's so common and so many people experience it. So I think it's getting more common for people to talk about. And I'm happy to, be here to support
Yeah, that's
women during that time. Yeah. Yeah. And then definitely with the pregnancy population and postpartum, I love that time of life. So
cool. That's
yeah, it's
pretty
a
amazing
joy.
that standard education was that limited when, as you're sharing and experiencing, like it's such an important role for the body. And especially with pregnancy, like an area that is shifting so much compared to
Right.
your bicep or something where, yep, I can see it,
Right.
identify it, and it doesn't shift a whole lot. And if it's off, maybe I don't use that arm, but the personal issues too, I think, are critical to be able to address. And I'm glad you
Yeah.
made a safe, open space for women to be able to share that with you.
Thank you.
Yeah.
Yeah, it's a very complex area.
So let's
That's
go in then. What is, from a basic overview from an anatomy standpoint, what are some of the things you're considering with pelvic floor?
yeah. Should I show you on my model?
Yeah, let's do that.
All right. I use this many times a day with my patients.
Hmm.
Um, so this is the pelvis, right? And I like to use a 3D model because you can really appreciate the many different attachments, front to back, side to side, diagonal, and it's so foundational to our body.
And go this way just a little bit. Um, yep, that way. With our camera, it's a little more narrow, so then we'll be able to see.
Perfect.
That's
How's
perfect.
that?
Yep.
Okay,
Now we see the whole thing.
perfect. So the pelvis is a bowl, right? And it really holds up our organs. And here in the model, you can see the bladder just behind the pubic bone here in the front, and then the uterus here. And this is almost true to size. Obviously, variation, but it has to expand a lot during pregnancy. And the rectum here in the back. It really is made up of these two hip bones, and they are connected at again, that pubic symphysis in the front. So it's I consider it a keystone of the body. And during pregnancy, there can be a lot of strain through there if there are asymmetries in muscle strength, mobility. So I do see there being quite a bit of pain there, pubic symphysis dysfunction.
Guys, when you're watching it, well, benchmark we'll use in our office sometimes is if you put your thumbs on your belly button and then
Yeah,
fingers land tends to be right about where the pubic bone is. So if you're
I
trying
love
to
that.
figure out on your own body right now where she's referencing, there's
Totally.
something you can use.
I love that. Yep. And then around on the back, you can see the tailbone kind of attaches between those two bigger bones, and that's the sacrum. The SI joint, you hear that a lot in pregnancy. It tends to be another area where there can be strain um, and pain. And so we now are going to dive down to the pelvic floor, and you can see where it really attaches the pubic bone to the tailbone. That coccyx is the little bone at the bottom of the tail, and it creates that foundation for the whole pelvic girdle. This is the first layer, and I'm going to dive in a little bit here. I think it's amazing that there are 3 layers of pelvic floor. A lot of people don't know that. And there are so many different muscles. So it's not as simple as just doing a Kegel. These first layers, I think of them as the squeezers. So they kind of work in a sphincter-like action. You can see the anus here is a sphincter. And then along that first layer, the urethra is here. So when we're, say, stopping or starting the flow of urine, it's kind of that squeezing-like motion. And some of these muscles, too, play a role in sexual function. And then the second layer is a little bit thinner, so it's not shown on the model, but it functions similarly to the third layer. And you can see where it's sort of shaped like a trampoline or a hammock, just holding everything up. And these muscles I call the lifters. So they have that effect of kind of drawing up and in. They can help with stability, and they work really in conjunction with the abdominals. And they're our core. They're part of our core. Yeah, I think that's all I'll say on there.
So how about, since we have the model out right now, say someone sneezes and they wet themselves. Could you maybe kind of tie that in as a real life example while you have the model there of what's happening?
Yeah, sure. So the squeezer muscles I talked about, they should automatically engage, and we should have the strength to be able to kind of hold that opening closed when we have something really strong happening in our pressure system, like a sneeze or a cough, right? So you can even think about it when you're bearing down. It's a lot of pressure going downward. And that sneezing and coughing is that pressure of air really pushing down on the pelvic floor and all the viscera coming down. So the pelvic floor should be able to squeeze against that. But when we leak, it's not able to fully close.
Got it. Okay.
Yeah.
Wonderful. So then when you see a woman during pregnancy, what kind of shifts start to happen? And if we can tie that in then to things they can do as far as stretching or strengthening, whether you want to model or not as you're going through that part.
Yeah. So we talked about how, right, the uterus has to really expand. And as the belly is growing, it's a lot more pressure on the pelvic floor. And so we do really have to rely on those muscles I call the lifters to be able to do that job of holding everything up.
You can slide back to your right a little bit.
Okay. This way?
Yep, perfect. You're back.
Okay. As we're going through pregnancy, I kind of like to think about 3 stages. And the first trimester, really, we don't have to change our movement too much. And whatever you're doing before, you can continue doing. In that second trimester, hormones start to shift. The belly is growing. It's a lot more pressure on the pelvic floor. And so we do want to work on stabilizing, and even through the first trimester, kind of just supporting all the muscles, just stay nice and strong. But that second trimester, as the relaxin is moving through our body, so that's the hormone that tends to make our ligaments more stretchy, we have to be careful about not doing too much strengthening of the abductors and adductors. So, and this is completely variable, right, with each person, but the muscles that attach to kind of the leg bones here, if we're doing too much resistance, it can kind of strain the pubic bone and the SI joint. So we want to be careful about that, especially getting into the third trimester. And we monitor symptoms along the way. So I think it's just really important to be aware of any pelvic pain, pubic bone pain, SI joint, when we're kind of thinking about resistive exercises with the legs. And also being careful about being on your back. So we don't want the viscera to be compressing on, the arteries and affecting blood flow. So stay on your back as long as you feel comfortable. There's really no set restriction on that. But I always keep that in mind when I'm giving exercises. And then for the third trimester, I'd like to focus on preparing for childbirth and delivery. So we want to actually work on pelvic floor relaxation and stretching a little bit of the pelvic floor. And, it's important to be both strong in contracting the pelvic floor, but also being able to relax. And that's when we really want a relaxed pelvic floor to let that baby come out.
Okay. And when you talk about strengthening, so is it just that the leg muscles that pull in and pull out, the abductors and adductors, that you're not looking to strengthen during the second trimester? Or are you looking to do other things to strengthen, like go for walks, or what is the balance there?
Yeah, it's always a balance. So I don't want to place any fear around doing too much resistive exercise. Again, if a person isn't having pain with those things or issues, then it's okay to continue strengthening. But walks are amazing throughout pregnancy. Yeah, and especially at weeks around 38, it's all right, let's just keep you comfortable. Let's keep you moving as much as we can. And just going on a couple short walks a day when you're reaching the end of pregnancy is enough movement.
Okay. And since you mentioned Kegels, how do you feel they play a role?
Yeah, so I mentioned earlier how we want to have a strong pelvic floor, but we don't want it to be too tense. And it's important to have control through the whole range of motion. And so doing too many Kegels doesn't always help. It's not always helpful. And again, it's a balance.
Rather than giving range of motion, is that why?
Yeah, it's some people tend to be too tight in their pelvic floor. And I think that this is something the research is coming out more and more, but it's not always that someone is weak when they are having issues. It can also be, or I should say, it's not, you can have weakness from being overly shortened or overly lengthened in the muscle.
Okay.
And so if you're doing, yeah, totally. So if you're doing so many Kegels and you just have like a super tight pelvic floor because you're overly gripping all the time, you might be weak.
Okay.
And then at the same time, I feel like this is more common for people to understand, like say after childbirth, if the pelvic floor muscles are over lengthened, they're also weak. So they work best when they're kind of in that happy medium.
Okay.
Not clear cut.
Okay. Years ago, I'd read an article on the difference between squats and Kegels. Because squats, maybe it sounded like it gives a little more length to the muscle. But on that.
Totally. And you're going through the lengthened phase and the shortened phase. As you're squatting down, things kind of open a little bit more in the pelvic floor, and then as you're coming up, they shorten. So it gets you through that range of motion.
Okay, got it.
I love squats.
Because I could see Kegels, they're just one thing, not full expansion.
Yeah.
Okay. Are there any other exercises or stretches you recommend to prep for labor and delivery?
Yeah. I might just share my screen quickly. So this is a list that I often give my patients.
Okay.
And should be sharing it now. A lot of yoga-based exercises.
There we go.
Can you see it?
Yes, we're up.
Great. So a cat-cow is wonderful. Inhaling as you're dropping the belly. And that actually relaxes and kind of opens the sits bones to relax the pelvic floor.
Okay.
In the cow stretch, you'll do an exhale. So it's really that cow pose that's going to help open and prepare for delivery. The deep squat is lovely too. Again, monitoring for any discomfort, especially in the pubic bone in the front. Stretching the inner thighs gently, and then focusing on deep breaths throughout all of these stretches. A deep inhale can help to relax the pelvic floor as well. Can work in side lying in a happy baby, especially if this one on the back is causing any symptoms like dizziness or nausea. It's a great one.
Yep. Okay. And I can see again the hips opening.
Exactly. And just a side body stretch there.
Got it. What's the purpose of the side body stretch?
Yeah, opening up the ribs. The ribs get kind of crunched up in there too with pregnancy. So that can be really helpful to breathe into the rib space.
Cool.
Yeah.
It gets bigger. That can be an easy add-on, because when baby's big and starts to crunch up there, so much discomfort that can come with that. So, okay.
Totally.
Got it. How about then as we go into after baby is born and hopefully they're nice and safely delivered into the world, for recovery afterwards, I guess two-part question. One is, what are some things you recommend? And then two, how does a woman know if they're ready to return to running or other exercises they want to do?
Yeah. So I typically will see a patient at the earliest 6 weeks postpartum.
Okay.
And ideally they've seen
all up until that point.
Say that again?
Is it up until the first 6 weeks, mostly laying low, resting?
Yeah. Just really focus on time with baby and adjusting to that new life and just marinating in it. um, I really don't think moms should put a lot of pressure on themselves to be moving a lot before 6 weeks. And walks are great. But other than that, even starting like a basic core program, I don't start before 6 weeks.
Okay.
Yeah. I think like working on some deep breathing can be helpful. But ideally seeing their OB or midwife team before the visit with a PT, before initiating any program. And then it really, I mean, there's so much variation, obviously, about how birth went. And with C-section, we want to be, a little bit more careful about the healing of the abdominal incision. And that's something I do check on and potentially do some scar tissue mobilization and the kind of manual work there to bring blood flow can be really helpful before starting a core routine. And then in terms of a vaginal delivery, so I do an internal vaginal assessment, which can be really helpful and a little bit more detailed than what you might get at a 6-week follow-up. And just making sure that those muscles are really working and coordinating together with the breath. Addressing any scar tissue that there might be from, tearing during delivery or episiotomy, if that happens. And then as you're progressing through, we're monitoring for symptoms. And the biggest things I look for are pelvic pain of any sort, any prolapse symptoms. So just feeling like things are heavy or kind of dragging in the pelvis. That is a sign that there's just a little too much pressure down on the pelvic floor and we might be moving through exercise too quickly. And then leakage. So just monitoring for that too. And it's a sign. So if we're seeing those symptoms pop up, it's like, all right, we'll maybe take it back a step, take it a little bit slower, try some modifications, but it's not as simple as just like starting with crunches. We want to, really connect with those deeper muscles.
Mm-hmm. And I can imagine that connection pays off so much down the road instead of wanting to rush back to your super athletic performance if that's what you used to do, or the big movements, but knowing that we've got to fine tune and make that connection to all the small muscles to set up a good support system for future, especially if a mom
Totally.
has multiple babies or other pieces that area is going to be worked out again.
Absolutely. And and honoring the fact that it took 9-10 months to get there. And so there's a bit of an unraveling process and just giving your body grace in its healing.
Right.
Mm-hmm.
And if someone is going through this process at home and hasn't reached out to a PT, are there cues that they can look for to know if they can push their body to the next level?
Yeah, I think really just paying attention to the symptoms that I mentioned is the biggest thing.
Okay.
For core strength, we want to watch for any coning or doming, if you've heard that term. It's a sign that, as your abdomen is healing back together, if we're putting too much stress, you can kind of get this kind of bulging out effect of the core instead of a kind of a nicer, like flattening corset type action of the deeper muscles. We might be using some of the more superficial muscles. So that coning or doming is a sign that core work might be a little too much.
Mm-hmm. Got it. Okay. All right. If someone is working at home and they think they might be stuck, what are some clues that they should reach out for a PT like yourself to get assistance?
Yeah. I think everyone should have assistance. We truly don't have enough postpartum support built into our system. If you have the resources, it's obviously a privilege to be able to do that, but just come see me. Hopefully someday it'll be a standard of care to kind of check in. But definitely if you're having any pain, leakage, heaviness, coning or doming that is difficult to manage, those are times where you should see.
Yeah.
Pain with intercourse is another one
Okay.
as you're getting back. Hmm.
Got it. And I could see too the earlier the better because as mom's body's recovering and the relaxin is leaving the body, there's some time to do some remolding that Mother Nature expects mom to be able to take that time to do. And
Yeah.
if you can have that another set of eyes early on, it's going to help catch those things right away. So as the body is getting its structure back, now that baby
Hmm.
isn't in there anymore, you can help assure that it's going to be nice and strong from the beginning.
Yeah, exactly.
Awesome.
Yeah, and we didn't even touch on the postural effects of nursing and
Mm,
stooping forward. So there's a lot, um, that we can do to help support
yeah.
posture as well.
And that's, I found, at least in our practice, is sometimes a dilemma of I know mom's hunched over all day and I want to help her open up and stretch, but I don't know where the abdomen's at and if it
Sure.
takes some time, to seal up and get strong again before they do too much stretching. So finding that balance,
True.
I think your support is great in that area too.
Great point. Yeah. Thank you.
Yeah, yeah, okay. And we can put your contact details in the comments below. But what is the best way to reach out, whether someone has a question or they want to schedule an appointment?
Yeah. I'm super responsive through email.
Mhm.
And so, yeah, Gauthier at vibrant.com. We can put that in the notes. And to schedule an appointment, you can call Vibrant. We have a scheduling team who can set up for an evaluation. We also have a free movement assessment. So if you're like, I don't know if this is right for me, what's it like to step through the doors of like PT
Mhm.
office,
Perfect.
we can do that for free for 30 minutes and set that up as a movement assessment. Um, yeah,
Yeah, I think that's an awesome next step where someone can actually, you can show here's the movement you should be able to do. And if you're doing this one over here,
yeah,
the person can see that disconnect, but
sure.
matching up and they know they're good. So I appreciate you offering that. All right. Well, let's wrap up then. Any parting thoughts? Otherwise, I think it was a great share.
Yeah, thank you. Thank you for having me. And yeah, good luck to everyone on their healing journey and during pregnancy and postpartum. It's such an exciting, beautiful time of life. So I'm glad we can be healers in that space. Yeah.
Absolutely. Well, thanks for your shares and your wisdom, Britta. And I definitely encourage you watching to reach out and get her expertise and that set of eyes for your healing. All right. Take care.